dissection is femoral triangle. What is femoral triangle? In the anterior aspect of the thigh, we get a triangular boundary bounded by some muscles. There is one muscle which takes origin from the anterior superior iliac spine and it traverses the whole of the femur and ultimately it is inserted at the upper part of the medial aspect of the tibia. That muscle is called Taylor's muscle or the sartorius. Okay, sartorius. And another group of muscles which are meant for the adduction of the limb, adduction of the thigh. This is the abduction and this is the adduction. So, some group of muscles which causes abduction and some group of muscles causes adduction, and they are placed medially. They take origin from the pubic bone, okay, and they are inserted over the linea aspera of the femur, and those muscles are adductor longus, adductor brevis and the adductor magnus. So, most superficially is we get the adductor longus muscle. So, when we get the muscles, first during our dissection we have to remove the skin where we will get the superficial fascia. In the superficial fascia, what do we see? What do we can expect? That means the cutaneous nerves and the veins, and here we will get most important vein, that is the great saphenous vein on the medial aspect, which is apparent in the superficial fascia, and ultimately veins moves towards from superficial to deep, so it will pierce the deep fascia and then it will and it will drain into the deep vein, that is the femoral vein. And what are those cutaneous nerves? One is at the lateral aspect, that is a lateral cutaneous nerve of the thigh. Then intermediate cutaneous nerves, they are two in number. One is lateral intermediate and medial intermediate. And most medially we will get another nerve, that is the medial cutaneous nerve of the thigh. So we will get these nerves, except lateral cutaneous, which is coming from the except the lateral cutaneous, the rest, that means the intermediate and medial intermediate and lateral intermediate and medial cutaneous nerve, they are coming from they are the branches from the femoral nerve, and more precisely from the anterior division of the femoral nerve. Now there is a lumbar plexus in the lumbar region, which is formed inside the abdomen. There is a big muscle that we can see in the posterior abdominal wall, that is the psoas major muscle. So, under the coverage of the psoas major muscle, we can get the lumbar plexus coming from L1, L2, L3 and part of the L4. From there, several nerves originate, that is femoral nerve, obturator nerve, lateral femoral cutaneous nerve, so and so. So, lateral femoral cutaneous nerve is also originating from the lumbar plexus, but we can find it in the lateral aspect of the thigh, where just below the anterior superior iliac spine, it is apparent, it is related to this and is coming from the abdomen, is traversing there is a muscle, that is a psoas major muscle, we can see, there is the iliacus muscle and there is the psoas major muscle, and we can find the lateral cutaneous nerve is resting over this muscle, that means the iliacus muscle, then ultimately it comes in contact with the anterior superior iliac spine, then it moves down and goes to the lateral aspect of the thigh. Except the lateral cutaneous nerve. Other nerves, that is femoral nerve, it is coming from the second, third and fourth. There is this is the posterior branch from the ventral rami of L2, L3 and L4. Root value is, just remember, L2, L3 and L4. It is coming from the lumbar plexus, it is traversing and it is placed in between two muscles, one is iliacus and one is psoas major. In between iliacus and psoas major, it is coming down and ultimately it crosses the boundary of the abdomen and it reaches the femoral region. And another ligament, we should have some idea, there is one ligament which demarcates the abdomen and the lower limb, that is the inguinal ligament, and its extent is from the anterior superior iliac spine to the symphysis pubis. From here to here, one ligament is there, that is called inguinal ligament, and that inguinal ligament is nothing but actually it is a thickening of external oblique aponeurosis. We know there are some anterior abdominal muscle, external oblique, internal oblique and transversus abdominis. This external oblique muscles becomes aponeurotic, like membrane-like, okay, tendon-like. It becomes thinned out, membrane-like, and that goes down, and from there this inguinal ligament generates. Actually, it's a thickening of that external oblique aponeurosis. So that is the inguinal ligament which demarcates the abdomen and the lower limb. So this nerve and all the vessels, that is external iliac artery, when it passes below the inguinal ligament, it becomes the femoral artery. Okay, and again the vein which is coming from below, that is the femoral vein, when it crosses the inguinal ligament, it becomes external iliac vein. So that is that ligament, that is the inguinal ligament, which is nothing but the thickening of the external oblique aponeurosis. Okay, actually demarcates the abdomen and the lower limb, and the artery which is coming from the abdomen, that is the external iliac artery, when it crosses, it becomes the femoral artery. Because they are in relation to the femur bone, so they are femoral. Femoral artery, femoral vein, femoral nerve. Now, when we will dissect the superficial fascia, we will get another fascia surrounds the whole thigh. That is the deep fascia, and here it is named as fascia lata. We know the fascia lata, we will be knowing what is fascia lata. Deep fascia in our in our arm, it is called brachial fascia. In the forearm, antebrachial fascia, pectoral fascia. Similarly, the deep fascia, it is named as fascia lata. Deep fascia in leg, it is called fascia cruris. And within the deep fascia, there is opening an upper medial aspect, which is called saphenous opening. And through that saphenous opening, the cutaneous saphenous vein actually it pierces that opening and ultimately enters and drains into the femoral vein. Okay. So, and this fascia actually covers all the deeper structures. What you can expect in the deeper aspect? Heart, lung, can you then tell me something? What you can expect? Can you expect brain here? Then tell me what you can expect. Very good, the muscles. That is, and the muscles of the anterior aspect of the thigh. And one of the important muscle is sartorius muscle, which is taking origin from the anterior superior iliac spine, and it goes down and it is inserted over the medial aspect of the upper part of the tibia, and it is called the tailor's muscle. When a tailor sits on the sewing machine, what he or she does? There is flexion of the hip and flexion of the knee. So this posture is maintained, and this sartorius muscle causes flexion of the hip and flexion of the knee. So it is called the tailor's muscle. And it is, so we can see one triangle here, okay, which has got base directed above and apex directed below, and it has got two sides. One side is formed by this is the sartorius muscle. So this is the medial border of the sartorius muscle, and there we can get another muscle here which is taking origin from the pubis. Okay. So this muscle is the adductor longus muscle, and this is the medial border of the adductor longus. Okay. This triangular muscle. So this triangle is formed by medial border of the sartorius and the medial border of the adductor longus, and they meets and forms the apex, and you can see meeting of point of medial and lateral border of the sartorius, and base is formed by the inguinal ligament. So inguinal ligament is not a fictitious, the femoral triangle is not a fictitious triangle. It is definitely, it can be perceived, it can be seen in our cadaver. So it is bounded laterally by the medial border of the sartorius and medially by the medial border of the adductor longus, and they forms the apex ultimately, and base is formed by the inguinal ligament. So, and this triangle should have roof. Roof is formed by skin, superficial fascia, deep fascia. And if there is a roof, there should be a floor. So, floor is formed by the, we can see several muscles we can see this is iliacus muscle. We can see this is the psoas major muscle. We can see another muscle, okay, which is called pectineus, and this is the adductor longus. So from lateral to medial, iliacus, psoas major, then pectineus and adductor longus. And this pectineus muscle is very interesting, like brachialis muscle. Yeah, we have seen the brachialis muscle. This pectineus muscle has got dual nerve supply. Medial part is supplied by the nerve which supplies the adductor compartment or which supplies the adductor group of muscle. That means by the obturator nerve. And the lateral part of the muscle is supplied by femoral nerve. Okay. So it's a hybrid muscle. Clear? So we can appreciate the roof, we can appreciate the floor. Here we can see in another picture, we can see this is the base and this is the apex by the and formed by the sartorius and the adductor longus. So this picture shows the floor. This is the iliacus muscle which originates from the hip bone. This is the hip bone. Already you are going through the hip bone. This is the iliac fossa, where we know this is the origin of the iliacus muscle. And another muscle, that is the psoas major muscle, it is taking origin from the lumbar vertebrae and last thoracic vertebrae. Okay. You will know in detail. And it is going down, it is passing through the inguinal ligament, and this iliacus and psoas major muscle, they move hand in hand. And they are inserted over the lesser trochanter of the femur. Okay. And in between iliacus and psoas major muscle, we will get the important nerve, that is the femoral nerve. Femoral nerve is apparent in between ilio-psoas groove. Okay. So we can appreciate iliacus, psoas major, the next muscle, most laterally iliacus, then psoas major, then pectineus, then is the adductor longus. And here floor, roof, you have come across the same in a diagrammatic way. Same thing, iliacus, psoas major, pectineus, adductor longus. Okay. Now we will come to the contents of the femoral triangle one by one. One is one artery, one nerve we can get. The name should be the femoral nerve. Okay. And another artery we will get, big artery, that is femoral artery. And medially we will get a vein, that is femoral vein. More medially we will get a canal. Canal. That canal contains only the lymph nodes. That is called femoral canal. Okay. Now, you can see another thing. This is the lateral cutaneous nerve of the thigh. I told you that lateral cutaneous nerve, L2, coming from the L2 and L3 level, the root value is L2 and L3 level. Okay. This is coming down, and which is also apparent in this femoral triangle. So it is the lateral most content of this femoral triangle. So most laterally we will get that nerve, that is the lateral femoral cutaneous nerve. And this nerve is entangled in the thigh. The compression of this nerve is very common if there is fluid accumulation, like when the subcutaneous fluid accumulates in some condition. You can name one condition, that is hypothyroidism, myxedema. There is collection of the subcutaneous fluid, so there will be pressure over this muscle, and if there is peripheral neuropathy, as it is very much common in diabetic neuropathy and other neuropathies. So that nerve is affected and typical sensation is felt. Okay, that is called meralgia paresthetica. Okay, peculiar sensation is felt. That is the meralgia paresthetica, which is related to that nerve. Now, this is the lateral cutaneous nerve of the thigh. It is coming down. And here we can see this nerve is nothing but the femoral nerve. Then we can see this violet colored vessel is the artery. And blue colored vessel, that is the vein. Okay. So, lateral femoral cutaneous nerve, femoral artery, femoral vein are the contents. And most medially, we can get a canal, okay, which communicates with the abdomen. That is called the femoral canal, where we can see some 5 to 6 lymph nodes. They are called the Clockett's lymph nodes. Okay. And this is the communication point between the abdomen and the lower limb. So if there is suppose there is any viscous under any pressure, if it comes out through this canal, or there any protrusion of any viscous through this canal from abdomen to the lower limb, it is called as, what is hernia? Protrusion of any viscous or viscera, like intestine or anything, any viscera, when protrudes out through the abdominal wall or it protrudes through any opening, it is called hernia. When it passes through this canal, okay, from abdomen to the femoral canal, it enters into the femoral canal, it is known as femoral hernia. There is other types of inguinal hernia, that is another type. There is the abdominal, and this is the in the femoral region, it is called the femoral hernia. So there are several hernias like inguinal hernia, direct inguinal hernia, indirect inguinal hernia. Okay, there are many hernia. It may herniate from the origin of the diaphragm. If there is deficiency of the origin of the diaphragm, it may come through that. Bogdolet's triangle is there through that Bogdolet's hernia. So there are several hernia. Hernia means protrusion of any viscera. You might be familiar in your family with your old parents or old like grandfather, grandmothers, they might be suffering from hernia. So hernia is any protrusion of any viscous. When it protrudes through the femoral canal, it is called femoral hernia. In this figure, we can see also the great saphenous vein ultimately drains into the femoral vein. Actually, the great saphenous vein is continued from there is a venar arch. We have seen the venar arch in the dorsum of the hand. So in the dorsum of the foot, there is another venous arch. And from from the medial aspect, that's the continuation of that venous arch is called, the vein is continued as saphenous vein. Okay, from there, and it traverses the leg, and it ultimately traverses the thigh, and ultimately it drains into the femoral vein after passing through the saphenous opening in the deep fascia. Here we can also see the different contents. Okay, lateral femoral cutaneous femoral nerve. Okay, and this is the femoral artery, femoral vein, and the canal, most medially. Okay, that is called the femoral canal. Now, nature has provided a tough fascial jacket over the proximal part of the femoral vessels and the canal. The femoral vessels and the femoral canal are covered with a tough jacket of fascia, and that fascia is called the femoral sheath. So femoral sheath actually covers the femoral artery, femoral vein, and the femoral canal. We will see it in other slide. Now femoral vein, you can see the femoral vein where you can see the drainage of the saphenous vein. You can see it here, but there might be there are other veins which drains into this femoral vein. They are lateral circumflex femoral, medial circumflex femoral, so and so. Okay. Now this is the cut section over this region, at the femoral region. Okay, we have cut it and we are seeing it from the below. Okay, the thigh is cut. There is a horizontal section is done. Okay, and we are seeing it from the below. So this is the anterior aspect and these are the posterior aspect. Okay, and we can see these muscles first we can see the skin, then we can see the superficial fascia, then we can see the deep fascia or fascia lata. Okay, and here we can see that another fascia which is or the fascia which is covering this artery, femoral vein, and the lymph node or the femoral canal. So this fascia, tough layer of fascia which surrounds these venous and lymphatic compartment, arterial, venous and lymphatic compartment, this is called the femoral sheath. Okay, and you can see most laterally this is the femoral nerve, okay, which is outside the sheath. This is outside the sheath. You can see this is outside the femoral sheath. So this is most laterally we can see this is the iliacus muscle, and most laterally we can find the sartorius. So posteriorly we can see there are so many muscles. Okay, most laterally we can see the sartorius, then the iliacus, then psoas major muscle, then pectineus muscle, and this is the adductor longus muscle. Another thing you can note, this artery along with a nerve in front of each, it is resting over this psoas major muscle. Okay, whereas this femoral vein and this femoral canal is resting over the pectineus muscle. So this femoral sheath has got 3 compartments, compartment 1, compartment 2, compartment 3, from lateral to medial. The lateral compartment has got artery, so this is called arterial compartment. Intermediate compartment has got vein, so it is called the venous compartment, and this is the lymphatic compartment, which is nothing but the femoral canal, from where we can enter into the abdomen, okay, which contains a lymph node or cloquet group of the deep inguinal lymph node, which is called lymph node of cloquet. So this is a very nice picture by which we can appreciate the arterial compartment is resting over the psoas major muscle, whereas the venous compartment and the lymphatic compartment is resting over the pectineus muscle, and most medially that is the adductor longus muscle. Now this is the picture of the femoral sheath, okay, we can see, okay. So it covers all the artery and vein and the nerves, okay, it passes down, okay, downwards. There are 3 muscles in the abdomen. From superficial to deep, there are 3 muscles. One is from outside inwards, external oblique, internal oblique, then transversus abdominis, and below the transverse abdominis we get a fascia, which is called fascia transversalis. Can you remember it? External oblique, internal oblique, transversus abdominis, then most inside is fascia transversalis, and more, if you go more inside, you will reach the peritoneum, parietal peritoneum. If you open the parietal peritoneum, you can enter into the peritoneal cavity or the abdominal cavity and the pelvic cavity. Okay. So fascia transversalis, just remember, fascia transversalis. And within the abdomen, there are some vessels. The abdominal aorta divides into common iliac, 2 common iliac. This common iliac is divided into external and internal iliac. So those arteries, the major arteries has got another covering, which is called fascia iliaca. Okay. So remember 2 fascia, one is fascia transversalis and fascia iliaca, because the femoral sheath is covered anteriorly by the fascia transversalis, and posteriorly, this is the anterior, this is fascia transversalis, this is posterior, this is from the fascia iliaca. Actually, when these vessels are developing, it drags those fascia from abdomen, and those fascia enters into the thigh. During the developmental period, the fascia transversalis and fascia iliaca are being dragged down by those developing vessels, and they remain. So after birth, okay, actually during fetal period, there is a posture of flexion. The fetus remains in the posture of flexion. So when it extends, it also extends that fascia. So it is nothing but, so femoral sheath is covered by the femoral sheath is nothing but the extension of the fascia transversalis and fascia iliaca. বুঝাতে পারলাম খানিকটা? ঠিক আছে, পরে আবার বুঝবে। So anterior wall, you can see this is written here. Anterior wall is the extension of the fascia transversalis of the anterior abdominal wall, and posterior wall is formed by the fascia iliaca, which also covers the iliacus muscle. All iliac vessels, muscles in the iliac region, okay. Fascia iliaca, which also covers these vessels, okay, and it comes down, okay. When these vessels are protruding from the abdomen to the lower limb, so this fascia, anterior one is from the fascia transversalis and posterior from the fascia iliaca, okay. And we can see the fascia iliaca nicely over the iliacus muscle. In our abdomen, we can see the iliacus muscle, okay, resting over the iliacus, and also the fascia iliaca, okay. So they are covering all these vessels, and they ultimately forms the femoral sheath. ঠিক আছে, ক্লিয়ার তো? সেম পিকচার, this is the fascia transversalis, and this is the fascia iliaca, and it is been dragged by this vessel, and you can see external oblique, internal oblique, transversus abdominis. Deep to the transversus abdominis is the fascia transversalis, and deep to it we will get the parietal peritoneum, okay, and deep to the parietal peritoneum we will get the peritoneal cavity, that means the abdominal cavity and the pelvic cavity. Clear? Fascia iliaca and fascia transversalis. Now we can see this is the funnel shaped shape of the femoral sheath. So it has got its base, it is opening towards the abdomen, and we can see there are two sides. One is lateral side, medial side. Lateral side is straight, medial side is oblique, okay, and there is an opening, okay, through which this great saphenous vein drains into the femoral vein. And in front of the femoral artery, we can see one nerve which passes first in front, then it passes laterally. It pierces the lateral part of the femoral sheath. Okay. So this is the artery, this is the vein, and most medially this is the femoral canal. And you can see this is the opening through which there is a communication between the abdomen and the lower limb, and it is been this is a ring shaped area. This is called the femoral ring. This opening, okay, opening of the femoral canal, okay, towards the abdomen is a ring shaped, which is called the femoral ring, and which is been covered by a septum, which is called femoral septum, over which the abdomen, over which a loop of intestine may rest. Loop of intestine may rest over this femoral septum, and when it is resting, there is a depression which is called femoral fossa. Femoral ring, femoral septum, and femoral fossa. There are three terms are coming. Okay. So what is femoral ring? Again I am repeating. The mouth of the femoral canal, okay, is covered by a membrane. So this mouth is a ring shaped, which is called the femoral ring, it is covered with a septum which is called femoral septum, over which we can get a depression which is called femoral fossa. And here you can see another ligament, okay, sickle shaped ligament. You can see the base is direct, this is the base and this is the apex. See, this ligament is also derived from the external oblique aponeurosis, and this ligament is called the lacunar ligament. Okay, so base of the lacunar ligament actually it demarcates the lateral medial boundary of the femoral ring, and whereas you can see another septum which is coming from anterior to posterior. There are two septum. You can see one is medially and one is laterally, which divides this compartment, the arterial compartment, venous compartment and lymphatic compartment. Okay, so this femoral ring is bounded laterally by this septum and medially by the base of this lacunar ligament. Femoral ring, femoral septum, femoral fossa, femoral canal. Femoral canal contains, we can see, some deep inguinal group of lymph nodes. There are T-shaped inguinal lymph nodes. Okay, the superficial ones have T-shaped. One has got horizontal groove, one has got vertical groove, and those are superficial, and the deep groove are placed over this femoral canal. Same thing, femoral septum, all the femoral septum, femoral fossa, those are coming, okay. And this is a femoral hernia, we can see, it is coming out. Through the abdomen, you can see a gut is coming out, okay, and enters into the femoral canal. Forget it. Abnormal obturator artery, it is a branch from the gradually you will know, okay, this is not the point to discuss. Now femoral artery beginning below the inguinal ligament, when it passes below the inguinal ligament, okay, it traverses through and through the anterior aspect of the thigh, and ultimately it passes through the adductor magnus. There is opening which is called fifth osteoaponeurotic opening in the adductor magnus muscle, and it becomes the popliteal artery. Okay, এগুলো আর বলে আর কিছু লাভ নেই, পরে আস্তে আস্তে তোমরা দেখবে তারপর জানবে, হ্যাঁ। So another artery which is developing, actually which is coming out from the, this is the femoral artery, okay. So it becomes the popliteal artery, and there are several branches. One branch is coming out from the lateral aspect, 3.5 centimeter below the inguinal ligament. This artery is called the arteria profunda femoris. We have seen arteria profunda humerus. আমরা হাতে দেখেছিলাম না? Similarly, here we are getting arteria profunda femoris. So this artery is also called the deep femoral artery, from where we are getting several branches, okay, which perforates the adductor magnus muscle. In the medial side, we will see that there is one muscle which is the adductor magnus, and that muscle is pierced by these several branches from coming out from the arteria profunda femoris. We can see this first, second, third perforating branch, and which is The fourth is nothing but the direct continuation of this artery. It is going to the back. Okay. And another two arteries, one is from going to the lateral side and one going to the medial side. They are called the lateral circumflex and one is medial circumflex femoral artery. So this artery, this is the arteria profunda femoris, is also called deep femoral artery. Okay. Both the femoral artery and the arteria profunda femoris artery, they first rest over iliacus, psoas major, pectineus, then over the adductor longus. In the floor, what we will get? From lateral to medial, iliacus, psoas major, pectineus, adductor longus. Okay. The femoral artery will pass like this, and ultimately it will rest over the adductor magnus muscle and ultimately enters into the opening, which is called fifth osteoporotic opening in the adductor magnus, and it will be continued as femoral popliteal artery. But this deep femoral artery or the arteria profunda femoris, actually it also rests over the iliacus, psoas major, pectineus. After that, it passes deep to adductor longus muscle. So, adductor longus muscle separates the femoral artery and deep femoral artery. আর বলবো না, মাথা খারাপ হয়ে যাবে। অলরেডি বুঝতে পারছি যে মাথা নিতে পারছি না, মাথা দেখে বুঝতে পারি। এই দেখো, so diagrammatic, we can see there are branches of the femoral artery. One is superficial circumflex iliac, superficial epigastric, superficial and deep external pudendal artery, and another is the profunda femoris artery. And the last branch is the descending genicular artery, and this is the opening in the adductor magnus, which is called adductor hiatus, and it becomes the popliteal artery. Now you can see the femoral nerve. About the femoral nerve, I should say, you just look at the picture. This is the femoral nerve, and femoral nerve divides into two. Just remember, femoral nerve divides into two branches. One is superficial branch, one is deep branch. From the superficial branch, we will get 3 cutaneous nerve, 1 muscular nerve. Whereas from the deep branch, we will get 4 muscular branch and 1 cutaneous branch. From the superficial, we are getting 3 cutaneous nerves. They are, already I have mentioned, medial intermediate, lateral intermediate, and medial cutaneous nerve of the thigh. Okay, these are 3 cutaneous nerves, and 1 muscular nerve for the sartorius muscle. So the anterior division has got 3 cutaneous. One is medial intermediate cutaneous, lateral intermediate cutaneous, and another is medial cutaneous nerve of thigh. And one is nerve to sartorius. Whereas the posterior division gives 4 muscles. What are those 4 muscles? There are quadriceps muscles. Quadriceps muscles. Quadriceps means 4 muscles in the thigh, anterior aspect. They are vastus medialis, vastus intermedius, vastus lateralis, and 1 muscle is going straight way, that is called rectus femoris. So these 4 muscles are being supplied by the posterior divisions. Okay. This posterior division is for 4 muscles, for vastus medialis, vastus intermedius, vastus lateralis, and another is rectus femoris. So 4 muscular and 1 cutaneous. That is the longest sensory or longest cutaneous nerve of the body. That is the saphenous nerve. Saphenous vein, we have seen, just in front of it, we will get the saphenous nerve. So, there are 4 muscular and 1 cutaneous. Here is 3 cutaneous and 1 muscular. এইটুকুনি জানলেই হলো femoral nerve, আর কিছু জানতে হবে না। মানে আপাতত দেখো, we can see it from the anterior division. We can see that this is only the muscular branch, that is the sartorius, and rest are the cutaneous branch, 1, 2, 3, intermediate, medial and medial cutaneous nerves. From the posterior division, rectus femoris, lateralis, vastus medialis, vastus intermedius, okay, and one is for the rectus femoris, and this nerve is passing straightway, that is the cutaneous nerve. So 4 muscular, 1 cutaneous. Here 3 cutaneous, 1 muscular, and from the trunk 1 nerve is coming down, passes behind the inguinal ligament and supplies the lateral part of the pectineus muscle, whereas the medial part of the pectineus muscle is supplied by the obturator nerve. There is another nerve in the which is called the obturator nerve. Root value is L2, L3, L4. Ventral division of ventral rami of L2, L3 and L4. It supplies the adductor group of muscles. They are the adductor longus, adductor brevis and adductor magnus. And it has got anterior and posterior division. Anterior division is in front of the adductor brevis. Posterior division is in front of the behind the adductor brevis muscle. So that is the obturator nerve.